Thank you for joining this live town hall, COVID-19 and older adults. My name is Erica, your moderator on the call. We'll be taking as many of your questions as we can on this live event. If you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of our staff. It will take down your name and where you're calling from. The next time you hear your name, you'll be live on the call and you'll be able to ask your question directly. Or if you're watching online, you can send your question through the website. Your Douglas County Commissioners, Roger Partridge and Laura Thomas, are joining us live via video today. And Carrie Erickson from Aging Resources of Douglas County, Gabrielle Fisher from Douglas County Human Services, and Dr. Douglas of the Tri-County Health Department will join us by phone. You can also watch and listen at douglas.co.us/townhall. During the next 90 minutes, we will take your questions and provide you with updates on the impacts of COVID-19 and older adults. If you're just joining us to ask a question, you can press *3, that's *3 on your telephone keypad, or you can send your question through the website. So let's get started with a welcome from your county commissioners. Commissioner Partridge, go ahead.
Good morning, everyone. Thank you, Erica. We look forward to today. I'm going to start out with you have Commissioner Partridge and Commissioner Thomas on the line. Unfortunately, Commissioner Layden will not be able to join us. There was a little incident over the weekend, and what we usually think of golf as a non-contact sport did not happen. And so we now have Commissioner Layden on injury reserve, but he is doing fine overall. He's to have a few outpatient medical procedures, take care of a few things. So he regrets he cannot be with us, but he is with us in spirit. So we certainly wish him well, and many prayers for his fast healing. So thank you for joining us. So during the last week, now this is our 11th town hall, I believe. During all of our town halls, we've heard a lot of questions regarding older adults. And even on our last telephone town hall dedicated to older adults, we were not able to get through all the questions. So we made the decision to hold another one today, which is what we're in presently. And we're actually going to devote a full 90 minutes to answer your questions. So please be ready, and we look forward to hear from you. Thank you, Erica.
All right. Thank you, Commissioner Partridge. And let's go ahead and hear from Commissioner Thomas.
Thank you, Erica, and good morning, Commissioner Partridge. It's good to see you. This is a personal topic to me, and I'm going to keep this short because we want to get as many questions answered for all of you. My mother is very independent, and she is 87 years old. She lives in an independent living facility, but she has been strident in staying in her apartment. They have happy hour in the hallways in the afternoon where they can visit with each other. But she's been clear that none of her 5 children are able to come visit her because she wants to make sure they all stay safe. So we all do our little things we can to make her feel loved and welcome. Last week would have been her 65th wedding anniversary, so we all pitched in and sent her some beautiful flowers. So there's still ways that we can all reach out to our loved ones to make sure they know we're thinking about them, but we want them to be safe. And that's why we're so pleased that so many of you are calling in and listening to these calls, because we want you to get the very best information that's available. So thank you for all of you for calling in. And Erica, it's all yours. Thank you.
Thank you, Commissioner. And again, if you are just now joining us and you would like to ask a question, all you need to do is press *3 on your telephone keypad to ask your question and get in the queue. All right, let's go ahead and take our first question. This is an online question from Fran for Dr. Douglas. And she wants to know, it has been very comforting to stay well informed at the county level. The BOCC's commitment to transparency helps fears and anxieties. My question is, it looks like we had a small uptick last week in hospitalizations. Are there concerns by the TCHD? Dr. Douglas?
Yes, good morning. Fran, thank you for your question. I as a fan of data, I do appreciate the interest of our county commissioners in sharing that data. That's why these town halls have been so terrific. It allows us to get that out. Douglas County hospitalizations have remained really quite low. Our website, unfortunately, is undergoing a repair, I guess is the kindest way to put it. We had to switch data systems over the weekend, and so we're a couple of days out of date. But at least looking over the data that I can get through next week, I don't see anything that really looks any different than what we've been seeing, which is an average of about 0.4 or 0.5 cases a day. That means hospitalization cases. That means one or so every other day. Now, we've certainly been hearing reports from other states of hospitalization increasing. It's been particularly a concern in Arizona, for example, but we have not seen hospitalizations going up anywhere in Colorado, and Douglas County's been about as low as any highly populated county, and that favorable trend has continued.
Wonderful. Thank you, Dr. Douglas. And we have another question for you. This is Abe online. Abe says, how long are COVID-19 asymptomatic carriers contagious?
So, Abe, that's a really important question that we're still trying to figure out the answer to. And here's the deal. We've got people that can be contagious with COVID who feel fine, don't have any symptoms, can fall into really three categories. They can be people who never, ever get sick. They have it. We know it because they get tested, and they don't get sick. And we've seen that on the Navy ships. We've seen that on the cruise ships. We've seen that to a less well-documented extent in our nursing homes. So we know that category of individual exists. It may be that as many as 20% of people with COVID fall into the category of they never, ever got sick. Then we have the people who are what are called pre-symptomatic. That is, they are going to get sick. Again, if you go back to the Navy ships or the cruise ships, there are people who were contagious a couple of days before they got sick, and then they develop some type of COVID symptom or another. The final category, not to make too fine a point on it, but I think we've heard so much about it, it's worth understanding, is the people that are considered, quote, mildly symptomatic. Mildly symptomatic meaning I didn't have a clue I had COVID. I just had a sniffle, or I lost my taste, and I didn't know that was related to COVID. So you got those three categories of people that are just not aware they have illness and might be transmissible. The pre-symptomatic people, those that are destined to get sick, look like they may be contagious for about 48, maybe up to 72 hours before they actually start feeling sick. The truly asymptomatic people, we just honestly don't know because no one's done the kind of detailed studies to really track on them over time. I think it's unlikely it would extend past the duration of someone with mild symptoms. That is typically going to be about a 10-day course. But in all fairness, we don't really know at any scientific level the firm answer to your question. I do want to clarify one thing. When we use the term carrier, we often refer to someone with an infectious disease who's got it for a period of time that may last for months or even years. So that term, Typhoid Mary, from Infectious Disease Hall of Fame sort of stuff, was a woman who was a carrier of salmonella and unfortunately infected a number of people that she lived with. She didn't know she was sick. There weren't antibiotics, but she carried the infection. We can see the same thing with people with hepatitis C who may not know they have infection, and they carry it for an indeterminate period of time. As far as we can tell, COVID does not result in a chronic infection where you carry it for an unspecified period of time. It really is best data we have is that it's an acute infection of variable duration, but when it goes away, it probably really does go away.
Wonderful, thank you. Let's go to a live question now, and Carrie and Gabrielle, if you could both answer this one. This is Dickie from Larkspur. Dick, you are live. You can go ahead and ask your question.
My wife is in an assisted living facility in Monument. Where can I get emotional support for myself as a caregiver, locked out of being with her for 3 months now.
Hi, this is Carrie. I'm so sorry that you're dealing with that. And a lot of people are struggling with not being able to see their loved ones. I would really encourage you to give Aging Resources a call. And what we have are several different programs, and one of them is emotional support via telephone. And that's probably your safest bet right now. But give the main number a call, and that is 303-814-4300, and we will get you set up with some reassurance phone calls. And when our caregiver support groups meet again, we can get you involved in that. But I think the phone calls might be beneficial for you right now.
Hi, Mr. Murray. This is Gabrielle. I would agree with Carrie. I think that would be your best bet. You can call Douglas County Human Services main line, and we can see if there's any other additional resources out there for you. That main line is 303-688-4825.
Great. Thank you, Carrie. Thank you, Gabrielle. Again, if you are just now joining us, we have a lot more people joining us right now. Press *3 if you have a question and you would like to join the conversation. Again, that's *3 on your telephone keypad to get into the queue. Next, we have a live caller. This is Bill from Franktown, and he has a question for Commissioner Partridge. Bill, you're live. Go ahead and ask your question.
Hello. Thank you for the opportunity to speak today. First off, I would like to apologize that in my excitement to be able to speak with the commissioners, I missed what the true topic of today's meeting was. So I apologize for that. But if I have your ear for a moment, I would like to strongly suggest that if there is any way possible to run the upcoming Douglas County Fair in the way that the fair has been in the past, I believe there are many, many kids that have worked really hard this year and are going to be impacted heavily in the financial side of things if it does not happen the way it's been in the past.
Bill, thank you. This is Roger. And to answer your first question, Bill, today is mostly a telephone town hall for older Americans. We have had many questions through our 11 town halls, and the last one we had specifically for older Americans, we didn't get to all the questions. So today we're offering 90 minutes for older American to give us questions and hear data, no doubt. Bill, you are right on. Your Douglas County commissioners agree with you 100%. So I can let you know that, yes, we will have a fair. We're going to call this a throwback fair because we know it's going to be a little bit different. But through I think it's going to be our 102nd fair that we will have, recognizing our rich Western and agricultural heritage, certainly 4-H and FFA, because it really is about the kids. That will go on. We will have a sale. We are working on many other events with Dr. Douglas Tri-County Health and the state CDPHE. In fact, we're looking forward. We may actually get to offer a tour for the executive director for CDPHE. So with that, regarding older Americans, we know that many of the open classes were by seniors and older Americans. So those have been canceled because of the concerns we are hearing for participants. And another thing we rely a lot on are volunteers. And again, older Americans are wonderful volunteering. They've been doing a great job. There is some concern there also. So what we recommend, if you have any discomfort at all, please continue to stay home. But those who do feel they can participate, help out in any way, we certainly encourage you to follow the precautions. We will take every precaution we can. That'll certainly be part of our variance. But yes, we look forward to the fair for the 4-H kids, for the FFA kids, for the sale, And we're even hoping we get to have some of the rodeos. That's what we are planning for. So hopefully that answers your question, Bill. Thank you.
Great. Thank you so much, Bill, for that question. Okay, next we have an online question. This is for Dr. Douglas. This is from Carrie. And Carrie says, why are businesses, especially doctor's offices and medical facilities, not taking extra precautions when it comes to seniors? My doctor stopped offering telehealth appointments June 1st. I'm surprised to realize that retailers seem to care more about my safety than medical facilities. Dr. Douglas, go ahead.
Sherry, thanks for that question. I would have to say that in general, my impression has been that healthcare facilities have taken a lot of steps to try to protect all kinds of folks coming in. It's not just that they care about the health of the people coming in, although I think that is generally true, but they know that if there's a perception that people aren't being well cared for and aren't being cared for in a safe fashion, they're not going to come in. And the revenue stream for hospitals and care providers of all kinds has really gone down over the last 3 months. So once again, there's a dual incentive to do it right. Now, I can't speak to your particular facility. I will say that many healthcare providers found that telemedicine ended up being efficient for them, efficient and effective and safe for the patients, and many have continued it. I can't speak to your individual provider, and I honestly can't, of course, speak specifically to the safety of the circumstances they offer, but I will say that in those that we're aware of, and certainly given that industry incentive to do it right, my impression has been that unless a facility is lacking personal protective equipment, which has been an issue in a few settings, although in general we think we've got a better supply chain now, patient safety in healthcare settings has been much less of an issue than we feared it might be.
Wonderful. Thank you, Dr. Douglas. Again, if you would like to join this conversation and you have a question that you would like to get answered today, you can press *3 on your telephone keypad and get in the queue. Okay, our next caller, we have Sue on the line, and she is in Highlands Ranch, and she has a question for Carrie. Sue, go ahead. You are live.
Hi, Carrie. I am president of the Senior Club in Highlands Ranch, and naturally we have had no activities since the middle of March. And the governor is saying you could have groups gatherings of up to 10 currently. And last week on the town hall, I think someone from Douglas County said that they had applied for maybe groups up to 50. So my question is this: when will it be safe for seniors to gather and do small activities in groups of 10 where we could social distance? And then eventually, will we be able to gather in groups of 50 when that becomes allowed? Currently, the governor has said, we're safer at home, but would it be safe?
Hi, Sue. Thanks for calling in. And the Highlands Ranch Senior Club is an awesome group. I have heard so many good things about that group. You guys have a lot of fun. And I know it's hard not to meet in person. We've been hearing that over and over again. And I think Dr. Douglas is probably better equipped to answer this question. But what I have been hearing from multiple folks is they're still really cautious about those group gatherings. I know the governor is saying groups of 10, and if you are all wearing your masks, and even outside is better, and social distancing, that maybe that would be, that would be a cautious way to start. I think those bigger gatherings, we'll let Dr. Douglas jump in, but I would be real cautious about that. We're still in a lot of danger here with the virus, and we don't have a vaccine. So I'll let Dr. Douglas jump in, but I would say after being outside is much better.
Yeah, hi. Thanks, Carrie. we're going to deputize you. You're giving great answers. I really would basically agree, Sue, with what Carrie said. We're at a really low ebb in Douglas County. We've got great weather. Frankly, the safest thing to do for seniors who are missing being together is to figure out spots in small gatherings outdoors where they can recongregate together. Now, currently, the ordinance or the public health order allows that to happen for groups of up to 10. I think you'd all have to do so with the recognition that there is no such thing as perfect safety, that there's going to be a small amount of risk, even with the kind of scenario that I just described. Now, that risk will be a lot lower if the people who are gathering among the 10 have been pretty much staying to themselves and not having a lot of contact. If you have friends in your group who, went to a family reunion and people didn't social distance so much, that's the situation where one could introduce infection. I think when you get to bigger groups, it gets a little iffier. Again, theoretically, outdoors, and ideally, if you can't be more than 6 feet apart wearing face coverings and staying 6 feet apart, theoretically, 50 ought to be no more risky than 10. But the problem is, I think we all understand human nature being what it is. It's tough unless you've got someone sort of almost serving as an usher or a kind of a gatekeeper to make sure that larger groups don't get too close together. So again, officially speaking, it's still groups of less than 10 are allowed. Those bigger are not allowed. Outdoors is going to be safer. Social distancing and face masking will make it even safer yet again. And when we get beyond 50, I think is honestly hard to predict. Those of us that are older than 65 are really the group that we want to be most attentive to trying to protect. And I get the fact that being cooped up and not seeing your friends takes a health toll, a mental health toll. And I do think we've got to figure out how we balance that. But I think those are some of the parameters that you want to be considering as you either do informal or even official kind of gatherings.
Great. Thank you, Dr. Douglas. We have another question for you. This is from Riggs in Highlands Ranch, a live question. Riggs, you're live. Go ahead and ask your question.
Yes, I am 73 years old and in good health, but I have a question around travel at this point. I have a plan to go to the Galapagos Islands in Ecuador in February, and I was curious from a medical standpoint what sort of risk I would take by doing that. Somebody there? Yes.
Yeah, I'm sorry, I was on mute. Riggs, hi. Great
yes.
question. Sounds like you've got a great trip planned. I hope it's going to work out to be able to take it. I don't think we can predict right now. If you were going to be booking travel, the first thing I would say is book it with travel insurance, because you just can't predict well enough to know what's going to happen. Right now, Latin America is one of the hottest spots in the world. I think Ecuador, Chile, Mexico are among the hottest spots. Now, the Galapagos are obviously, 1,500 miles away from mainland Ecuador, and I don't know what's happening there. I will say the things you'd have to consider would be the following. What's going on in the epidemic at the time you're going to be traveling? How's your air flight going to be? Many domestic carriers are, not filling middle seats, which provides some modicum of protection, but that's a pretty long flight. Thirdly, be aware that there have been circumstances, at least in the recent past, when people got to out-of-country destinations, and then all of a sudden there was an exposure they didn't expect, and they ended up having to be quarantined in that country. They couldn't get back on an airplane and come home. They sort of got stranded. So I think it's too early to tell. It's possible that by that point next year, we will be starting to implement vaccines. That's sort of some of the most optimistic thinking. But I would have to say, in all honesty, that even if we were implementing vaccines, they probably wouldn't have been widely enough implemented to have kept things under control. So hard to predict. I wouldn't buy anything I couldn't get my money back on, and just be attentive to what sounds like it could be a fantastic destination depending on the epidemiology.
Great, thank you, Doctor. Okay, we have a question for Carrie. Again, Carrie Erickson is the Executive Director of Aging Resources of Douglas County, and this is Andrea. She is live on the phone. Andrea, go ahead and ask your question.
Oh, good morning, everybody. Can you hear me?
Yes, we can hear you great.
Oh, fabulous. I just wanted to acknowledge the gentleman who is not able to see his wife who's been in assisted living for 3 months. And I was hoping that you could repeat the crisis, the help center numbers again, because you ladies read it off very quickly. And that being said, I know you'll do that. I appreciate that. My father has been in a lockdown facility, also in assisted living, and he's being well cared for. And but it is a lonely situation, and that isolation is hard on everybody. I mean, he just celebrated his 90th birthday, and we went to the garden area, my brother and his wife and I, to say hello, and it's hard. They haven't had haircuts. The attentive, I mean, they're healthy and they're safe, but it's a lot of neglect in some ways, unforeseen and not planned. But it's sad. No movie nights, no interaction, and for people that really want to get together, seniors, it's very difficult. They can't arrange getting 5 or 10 people together, and obviously, especially in assisted living. So maybe you want to comment to some or all of that.
Sure. Hi, Andrea. Gosh, it's so hard, and I completely can empathize with everything you're saying. And having your loved ones inaccessible is probably one of the hardest things about this pandemic, because we want to go and we want to hug and visit and hold hands, and we can't do that. So it's not a crisis number, but Aging Resources, we do have staff that can talk you through some of this, and that number is 303-814-4300, and we have heard from so many people that are in the same boat as yourself and your family. And happy birthday to your father. Turning 90 is pretty exciting, and I hope you get to go soon and celebrate in person with him. But one thing I have heard that has been on the positive side, and that is calling your assisted living facility and asking that staff help your loved ones with a video chat call, if that's something that they can manage with some help, because then at least you can see faces, and seeing faces is so much it's just more stimulating and a better connection than just a phone call. And so we've been seeing more and more of the facilities bring in video chats, and that's fabulous. You got to go to the courtyard, and I'll just be praying that we have a vaccine soon and you can be in person with your family. But call the office anytime and we'll visit.
Wonderful. Thank you so much. Next, we have Beatrice in Highlands Ranch. And this question is for Dr. Douglas, but also Commissioner Thomas, if you could weigh in as well on variances after we hear from Dr. Douglas. Okay, Beatrice, you can go ahead and ask your question live.
Thank you. My husband and I are in our mid-70s, and we're anxious to make use of the neighborhood pool. However, the pool is closed right now, and I'd like to know what is going on, when and if it will open this summer. Thank you.
Beatrice, thanks. I'll try, and Commissioner Thomas, who I know has been interested in this topic, will also respond. I'm going to have to confess, I'm pretty sure, but I've had some of our staff sort of be experts on areas that I can't keep up with, that our pools, as of the current public health order from the governor, are allowed to be open. And so I think a neighborhood pool like the one you described ought to have the capacity to be opened, taking certain precautions, allowing it to, taking the precautions that are provided in the public health order. So there was a lot of pent-up interest, especially as we got into the month of June, and I thought we had corrected that. Laura, usually you ask me that question. I'm having to confess. Can you confirm that my understanding is correct?
Yes, Dr. Douglas. So if we are talking about an outdoor pool, the governor's Safer at Home and Vast Grade Outdoors order allows outside pools to be open for 50% of capacity up to 50 people. Inside pools can be open for 25% of capacity. And since the caller is from Highlands Ranch, I'm wondering if you're also referring to pools in the rec centers. I spoke with Jamie Noble at Highlands Ranch Community Association last week to just get an update on how things are going with their rec centers. And she told me that they have pools open for individual lap swim. And I think she thought maybe 2 people so far had taken advantage of that. So if you are looking to have some individual swim opportunities, if I were you, I would reach out to one of the pools at the community rec centers, those 4 rec centers, Northridge, Eastridge, Southridge, or Westridge, and see what their pool opportunities look like. Because there's so few people using those pools, you might have a pretty good success and a lot of fun and exercise. Thank you for that call.
Great, thank you both. Let's do a quick question reminder. Again, if you would like to ask your question today, press *3 on your telephone keypad, and you can get into the queue to ask the question. Let's do our first poll, and you can answer this on your telephone keypad. Question 1, have you participated on previous Douglas County live town hall events before? So if you have participated, if you've never participated, you can press press 1 on your keypad. If you have participated on one or a couple events previously, press 2. And then, yes, I have participated, please press 3. Again, have you participated on previous Douglas County events before? No, this is my first time, press 1. Yes, I have participated on one or a couple, press 2. And yes, I have participated on several events, press 3. Okay, if you'd like to get into the queue to ask your question, you can press *3 to get in the queue. Okay, let's go to our online question next. We have a question from Jim, and this is for Dr. Douglas. He says, for seniors who have COPD or need oxygen tubes, is there an alternative to wearing a mask? Dr. Douglas, go ahead.
Yeah, Jim, that's a very important question. The simple answer is that it's tough to wear a mask if you've got an oxygen tube. Most fabrics also make breathing more difficult. So someone who's has COPD on oxygen, I think masking is going to be really challenging. And by the term challenging, I mean, I just don't think you should push yourself to do that. Face shields are personal protective equipment that have been marketed and are typically used by healthcare providers to protect their eyes. And they don't do as good a job. They're plastic. They're kind of flippy around. Stuff, air can come in on the side. They have been in variable supply because of their need in hospital kind of settings. I think that could be a modicum of an additional resource to use, but honestly, if I was had COPD with an oxygen tube, I think you'd want to be awfully careful about being in group settings anyway. Probably one of the safest strategies would be to have, especially while we've got such good weather, is to have your visits in an outdoor settings. So, I mean, by all means, try out a mask. T-shirt material is said to be among the most breathable and provide the best value for its breathability. But again, if you're oxygen dependent, you're probably not going to find that works. And either the face shield or simply just being really careful with social distancing is probably going to be your best strategy.
Great. Thank you, Dr. Douglas. If you're watching this video online, by the way, and you would like to ask a question online, you can go to douglas.co.us/townhall to submit your question. Next, we have a live question. This is Helen in Parker for Dr. Douglas. Helen, go ahead. You're live.
Yes, I am going to travel to Nebraska next week, and I am going to fly. I am just wondering, I know I'm going to wear a face mask, but I wonder if there is any other precautions. I do have my hand sanitizer, and that's what I'm asking.
You've obviously been planning ahead, Ellen, with your face mask and your hand sanitizer. You know, I think the other strategies I would suggest is just be attentive as whenever you can during the flight experience of trying to be distanced from other people. Depending on your airline, you may be allowed to board early, or if not, just be prepared to board late and sort of hang back and don't crowd into those crowds as much as, or avoid those crowds as much as you can. The airlines have become, from what I am told, incredibly attentive to cleaning the airlines. So I think the surface issue is probably less of a concern. But if you do see someone touching a surface you need to touch, a doorknob to the bathroom, this kind of thing, by all means, use your hand sanitizer. And if you're using the restroom on the airplane, wash your hands after that to provide added precautions. So I think those would be the main things to consider. You know, it might be a good time if you're the kind of person who likes to carry on bags to avoid it, just because carrying bags can be clunky and you might have to bump into other people. Maybe a good time to check your bags. So I think those would be the general best precautions to think about during a trip.
Great. Thank you, Dr. Douglas. We have another question for you. This is an online question from Debbie, and she says, is there any projection on when assisted living nursing homes may be able to take new patients? We were looking into a memory care facilities in January and February for our 92-year-old mom, but then COVID-19 happened. So any idea on timing?
You know, I don't have a good answer for you, Debbie, and I'm wondering if it's any chance Carrie might. I mean, the assisted living, memory care units, various long-term care facilities, all were really challenged during the COVID epidemic. I think those challenges haven't gone away, but I think many of them are on firmer footing now. One of the issues that was happening were hospitals were trying to discharge patients into the units, and that was compromising some of the space capacity. So there's not a particular public health order preventing a new person from coming into a facility like that. I think it's really availability. And I honestly can't speak to where that particular supply situation stands at this point. Carrie, I don't know whether you've got any insight given your perch running aging resources.
Sure. Hi, Debbie. I think that the assisted living, the memory care, group homes and facilities, it's still really touch and go. It's tricky to get somebody new in. It's tricky for the people that are already there. As Dr. Douglas said, I don't know that there is a mandate against it, but I think that they're just trying their very best, most of them, to just keep things as is until the pandemic is improved a little bit. One thing you can do, and I don't have the number on me right now, but there is an ombudsman program through the Denver Regional Council of Governments, and their full job is to monitor, assess, and assist with assisted living and nursing care facilities within our 8-county region. If you want to give Aging Resources a call, we will get you a contact, and they will have more of an update measure on the pulse of what's going on in those nursing facilities. Again, Aging Resources can get you that number, and that's 303-814-4300. Thank you.
And Gabrielle Fisher also has that phone number. Gabrielle, did you want to go ahead and give that out?
Sure. The ombudsman number for Douglas County is 303-455-1000. So that's going to connect you to Tri-County Health, and then you ask to speak with the ombudsman for Douglas County region, which is Region 3A.
Wonderful. Thank you. All right, great. Let's go to, I'm just going to say that one more time in case anyone didn't hear that. 303-455-1000. All right, what outstanding questions from all of you that are coming in on the phone, coming in on the website. We hope this information is very useful to everyone on this call. We're about 1/3 of the way through our live town hall discussion about COVID-19 and older adults. And if your question hasn't been answered, we have time to hear from you. So press *3 on your phone, or you can send your question online through the website at douglas.co.us/townhall. Now let's hear from Carrie Erickson, the Executive Director of Aging Resources of Douglas County. Carrie, go ahead.
Hi, thanks for joining us, everyone. This is so nice to be able to present just for our older adults in Douglas County. And if you have any additional questions or need resources or services for yourself, your loved ones, please give Aging Resources of Douglas County a call. We have multiple programs, services, and resources to fulfill our mission of helping older adults stay independent and in their homes. Again, our phone number is 303-814-4300. We are a nonprofit serving all of Douglas County. Our services are free of charge, and we have a great staff and volunteer force to help you out. So feel free to connect with us.
Wonderful, thank you. And we have a lot of questions coming in about antibody testing. So let's go ahead and go to Ian and Parker for Dr. Douglas. Ian, go ahead and ask your question.
Hi, yes, my name is Ian. I work at an assisted living facility. I'm really glad that we have better testing now. I currently don't have any symptoms. And I was wondering if you guys do any reliable antibody testing. You know, there's a lot of it out there, but I don't know how much of it is reliable.
Hey, Ian, you broke up a little bit. I think I heard you say you work in an emergency room, you're feeling fine, and you're wondering if the antibody tests are reliable enough to consider. Did I get that right?
Ian, are you there?
Yes, I'm here. Yes, that's correct.
Yeah. Okay. Thanks. I think the antibody tests have a lot of promise associated with them. Honestly, I think we got to continue to approach them with a grain of salt. The FDA allowed the 100+ tests to go on the market, with very few of them receiving really any kind of review at all. The ones that did get reviewed were reviewed under something called an emergency authorization review or approval process, which is really incredibly scant. And as the tests have been out there, various labs that have assessed them in a somewhat more stringent way have found that their test performance is measured by their sensitivity, meaning if you've been infected, does the test show positive, or their specificity, meaning that if you have not been infected, does the test show negative? Ideally, you'd want those things to be 100%. No diagnostic test is ever 100%, but you want them to be pretty high. And the data suggests that the tests are really quite variable in terms of that performance characteristic. Now, you add into that a positive test that's actually real, that is, you really had it. We don't know whether that means that you're protected against future infection or not. Most people are interested in the antibody test because they'd like to find out, hey, did I have it 6 weeks ago when I felt bad and I couldn't get a test? And does it mean I'm protected? We simply don't know enough about what antibodies mean vis-a-vis that latter question. So I would say if you're intensely curious and you're prepared to live with some ambiguity about the test and it's not going to cost you too much, they're out there, you can get them ordered. But I think I'd be awfully careful about banking a lot on the results given those caveats.
Wonderful. Thank you, Dr. Douglas. We have an online question coming in for Carrie and Gabrielle. And the question is, where can I turn for help with food, transportation, and housing if I just don't have enough money to pay for it?
Thank you. That's a good question. There's multiple places to turn. If you're an older adult or calling for an older adult, you want to give Aging Resources a call because we have a couple different programs that are going right now. One is we're delivering groceries to different areas of the county, and so we're able to do that. We're working with different food banks in order to acquire food for folks at no charge, and so that program is going on. There's also some emergency assistance money that we have set aside to help our older adults during this time. But for other services, I'll let Gabrielle jump in because her department has some resources as well.
Hi. Douglas County Human Service does have a variety of different services, including ongoing food assistance, some cash assistance for a variety of different scenarios, including emergency one-time only or some ongoing ones as well, and some medical insurance help, such as the Medicare Savings Program, which, if eligible, the state of Colorado will help pay for those Part B premiums from Medicare. The best way to get more information on all of those to see if you would be eligible, or if you're not eligible, if there's anything else that we can help offer, because we do work closely with different agencies and community partners. The number would be to call 303-688-4825. That is our customer service team. They can help walk through how to apply. We do have several options to apply that do not require you to come into the office at all. Or if you would like more information before applying, you can ask to speak with myself, Gabrielle Fisher.
Wonderful. Thank you, Gabrielle. And again, if you need the phone number for the Aging Resources of Douglas County, if you need help, if you need to call that number, if you have questions, I'm going to give it to you right now. It's 303-814-4300. Okay, wonderful. Let's go ahead and go to our next caller. This is Jessica, and she has a question for Commissioner Laura Thomas. Jessica, you're live. Go ahead and ask your question.
Hi, this is Jessica from Highland Ranch. First, I want to say thank you to the commissioners for their hard work. My second question, I have three questions, is I was wondering if there was any plan about when the movie theaters can open again? My second question is, when will the restaurants be able to increase the capacity? And also, can we have a parade on the 4th of July? Thank you.
Good morning, Jessica. I think I've worked with you on getting a church open, so I know who you are. So thank you for listening and calling in. So your first question is about theaters. The county has gotten a variance request approved by Tri-County Health. It is now at the state health department, and we're waiting to see if the state health department will approve that variance. We are working with industry leaders in movie theaters, but we have heard that Hollywood has stopped doing videos. They've stopped making movies right now. And until the theaters have a lot of new releases, they are probably not going to be able to open the movie theaters. So there's more to this answer than just, will the state allow movie theaters to open? But know that we're still working on that. You've asked about a parade, and I want you to know that Commissioner Partridge has been working so hard to get the fair open in early August, but we have been told there's no way that we can have a fair parade in August. And your last question was about restaurants. The county has another variance that's pending with the state right now. It has been approved by the county, the local health department, Tri-County Health, and it will allow larger gatherings. I am hoping that if we can get more gatherings together, that we can then apply that to restaurants. I'm not sure if that's going to work, but know that your commissioners are trying every way possible that we can think of to get more and more things open. And the reason we're doing that, Jessica, is because our numbers are so low. So in the last, I think 3 weeks, we've had 11 people hospitalized. And it's because of the really low cases that we're having here in Douglas County that we feel comfortable working with Tri-County Health and the state health department to get more things open, because we are the healthiest county in the entire country here in Douglas County. So we just don't have the same risk here that other places do have. So Jessica, keep working with us and reaching out to us, and we're going to keep delivering for you. Thank you, Jessica.
Wonderful. Thank you, Commissioner. And if you have a question you would like to be part of this conversation, press *3 on your telephone keypad to get into the queue and ask your question live. We have an online question from Mary, and this is for Gabrielle Fisher, who again is the eligibility supervisor for Douglas County Human Services. And Mary would like to know, will the AARP tax preparer resume before July 15th? Go ahead, Gabrielle.
Hi, Mary. I do not know the answer to that if they will resume, but why don't you give our office a call at 303-688-4825, and we can work together to find the answer to that question, or if there's any other resources that we can help with taxes before that deadline.
All right, wonderful. Thank you. And again, that phone number is 303-688-4825. All right, let's go to our second poll question. We'd like to make sure that you stay informed about what's happening in Douglas County. If you would like to continue receiving information from the county, just press 1 on your phone right now. Again, that's just press 1 on your phone if you would like to stay informed about what's happening in Douglas County and you would like to keep getting information. Next, let's go to our live caller. We have Rosemary in Castle Rock, and she has a question for Dr. Douglas. Rosemary, go ahead and ask your question live.
Yes, I've been hearing that UV lights, portable UV lights, can help disinfect various things like a keyboard, a telephone, possibly even things around the kitchen, your microwave. Do those actually work? And is there anything special I should look for in that portable UV light?
Rosemary, interesting question. I'd have to say that we do believe UV light probably inactivates coronaviruses. That's one of the reasons that we think outdoor contact is probably safer than indoor contact. I don't know of any information about the duration of the UV light exposure guide you. I will say that there's nothing I've seen about UV light that would suggest it's more effective than what, at least for some settings, might be easier to use, disinfectants. Now, I guess I'm sort of thinking out loud here. A computer keyboard that's used by multiple people, you don't want to get wet stuff inside the keyboard, but I think a damp rag with disinfectant on it would suffice to reduce exposure or what's called fomite transmission by environmental surfaces pretty readily. So I don't have a direct answer for your UV light question. I am thinking that in most circumstances, it probably doesn't provide a lot of additional value to disinfectants. We'll look, and I'll do me a favor, actually, because you've intrigued me. Send me an email, jmdouglas@tchd.org, and I'll see if any of our team can dig into that for you. I don't think we're going to find much. We'll be happy to look. Thank you.
Thank you, because it's very hard to find disinfectants. It's almost impossible to buy them right now.
All right, wonderful. Thank you. Let's go ahead and go to another online question. This is for either of the commissioners. It says, I really rely on both going to my church and visiting the library to keep active and to see my friends. So what are you doing to help those places open more fully?
This is Commissioner Thomas. I would be happy to take that if Commissioner Partridge would like me to. Okay, so Bob, who is the executive director of our libraries, his last name is Pasnick, has just been an advocate for getting the libraries in Douglas County open safely. And he recently took the question to his trustee board, and they have approved him opening the libraries on June 29th. Now that will work in concert with a variance that has been approved by Tri-County Health and is currently at the State Health Department. So we are hoping that that will be approved shortly by the State Health Department. But even then, the libraries won't be able to open until June 29th because there's so many things that they're getting in place to be safe. So that's the option. I'm not sure that their meeting rooms will be open right away because right now they can only have 10 people in a meeting room, but the libraries will be open. And the other question was about, can you help me, Erica?
I'm not sure I heard the other part of that question. Oh, I'm sorry, the online question. Yes, of course, the library. She wants to know about both library and church.
And church. Okay, thank you, Erica. I apologize.
Yeah,
so churches have been able under our variance to have quite a few people in them, up to, I thought it was 175 because of the spacing distances based on the size of the church. And so I would encourage you to go to our county website. Our county website lists all the variances that have been specifically approved by the State Health Department. I know there are many churches still that are not opening up to the level in Douglas County that they are able to. And if that's the case, I would encourage your pastor to read our variances. And if you'd like to have them reach out to me, I'm happy to help direct them to Pastor Mike Polhemus at the Rock Church. He really has been the leader with the pastor group in writing these variances that can get more people in their churches in a very safe way. So again, reach out to me if you have any questions, and we'll get your pastor hooked up to get some good answers for all of you. So thank you for those great questions.
Thank you, Commissioner. And next, let's go to Sandy in Parker. She's live. She has a question for Dr. Douglas. Sandy, go ahead.
Thank you. I really think you already answered it, because while I was getting in queue to ask my question, it was around testing and tracing and what's going to be available for us in Douglas County.
Yes, Sandy. Hi. I actually don't think we've talked about that question. Both testing's in pretty good shape in Douglas County, but we are working with partners across the community to try to get it better. I mean, the big picture on testing is that 4, 5, 6 weeks ago, the message was we don't have much testing capacity. If you're not really sick, just stay home and stay isolated just in case you have COVID. That message has changed. If you've got any of the COVID compatible symptoms, fever, shortness of breath, cough, chills, loss of smell or taste, those are all possible COVID-like symptoms. Now, right now in Douglas County, we have so little COVID that the chances are reasonably good that will actually be something else, because the test positivity rate depends on just how common a disease is in the population. But those would all be good reasons to be tested. And there are on our website information about really for all 3 of our counties, including Douglas County, where you can be tested. As I said, we're trying to increase that as testing capacity, or rather testing reagents become more available. The other reason to be tested is if you have a known exposure to someone with COVID. You went on a trip, you visited someone, they called you the next day, said, whoops, I just found out I have COVID. As a contact to them, it would be good for you to go ahead and get tested as well. Contact tracing is a time-honored approach in infectious disease control that's been used for over 100 years for TB and measles and smallpox and HIV and frankly just pretty much every infectious disease that was really critical in the Ebola outbreak in West Africa, for example. And we are now beginning to get capacity in Douglas County to do that. We're training our second batch of volunteers this week who will be helping us with that. Douglas County and our other 2 sets of county commissioners are working with us on identifying some resources for us to be able to hire and train paid people, not just volunteers. One reason our website is down right now is that we are tweaking our database to be able to accommodate contacts more readily. I want to emphasize, because contact tracing has frankly never been as widely talked about, that this is a voluntary matter. The information is all confidential, and it's really being offered to the individual who may have been exposed as a service and not as a, here's public health coming to regulate your life sort of thing. We are going to give you advice about being quarantined to try to prevent exposing other people to the infection, but it's really being done to help you manage your potential exposure. And I'm hoping that capacity is going to be growing really quite progressively over the next 6 weeks.
Thank you, Dr. Douglas. And what's on your mind? If you're listening and you would like to ask a question, you can press *3 on your phone. If you're online, you can send your question through douglas.co.us/townhall. And remember, if your question isn't answered this morning, we still invite you to submit your question, again, at douglas.co.us/citizenconnect, and we will follow up with you directly. Okay, let's go to our next online question. This is for Commissioner Partridge. The Colorado primary election is this month. Is COVID changing how voting will work? Commissioner Partridge, go ahead.
Very well, Erica. This is certainly the hot topic right now, along with the COVID. So the primary election is on. The primary date is June 30th. So you should have received, and if not, it'll probably be by Wednesday this week, you should have received your ballot. The Douglas County Clerk and Recorder encourages you to vote and return the ballots to one of our 19 drive-through or walk-up county-controlled 24-hour ballot drop box locations throughout the county. And we know based on previous elections, about 80% of the Douglas County voters prefer this ballot method. But if not, we do have 3 voter service and polling center locations, and they will begin opening on June 22nd. And you can visit, now I'll say this slowly, douglasvotes.com. That's www.douglasvotes.com for locating those locations and many other election questions. Or you can call 303-660-7444. Again, 303-660-7444 for any updates and by chance you did not receive your ballot. So hopefully that provides you all the information. And so in Douglas County, we encourage you to vote early and we encourage you to only vote once.
Wonderful. Thank you, Commissioner. Our next question is for Carrie Erickson. Again, she's the Executive Director of Aging Resources for Douglas County. And their question for you is, hairdressers are open, but people are saying that seniors still shouldn't go. Why?
That's a really good question and one that we're hearing a lot. And I don't know that we're saying seniors should not go specifically to hairdressers, but the information that we're getting nationally and more specifically from Dr. Douglas is minimize your risk. 65 and older are most at risk, and if you can do anything to minimize your risk, I think you're keeping yourself safer. So I know it's frustrating not going to do the things you want to do, but you're in very close contact with a hairdresser. I know they're open and you can wear a mask and your hairdresser can wear a mask. And so really at the end of the day, the decision is yours whether or not you want to go. But I would just be cautious because going to the hairdresser is something that you could put off if you wanted to or if you needed to. But again, it's your decision. Use your mask. Make sure your hairdresser's using the mask.
This is Dr. Douglas. I'll just chime in. Carrie, once again, is right on target. Great answer. I would agree with everything she said. One caveat, there are hairdressers, it's my understanding, because I've got older friends that have taken advantage of this, who've done home services. Now, that doesn't mean the hairdresser, him or herself, couldn't be infected and couldn't bring it into your home. But, you know, one of the issues of going out is that there may be other people in the facility, other hairdressers, other clients, this kind of thing. So I think that's just an example of trying to think around the curve of things that could reduce your contact with other people. I would underline and strongly endorse, if you go into the hairdresser, you finally worked up your nerve, you've got your mask on, you walk in and their mask is like below their nose, or the other one is, you know, the next stylist is, you know, got it sort of half-cocked, not really in a place. That's a warning sign. That's a place to say, thanks, I'll make another appointment. So, you know, in all honesty, Carrie's right. We can put off going to a hairstylist or whatnot, except we don't know how long this is going to go on. And I get the fact that you don't want your hair down to your waist. And so I do think there is some understandable desire to try to do this. But I would just sort of think about ways that you can do it as safely as possible. The fewer people around, the better. The more masking going on, the better. And that's also a place to be sure that folks, including yourself, are doing hand washing and hand sanitizer.
Thank you, Dr. Douglas. And we also have a lot of questions coming in about testing and free testing locations. So Commissioner Thomas, if you could share information about where to find that information about testing, which also includes a free location at Stride Community Health Centers. Commissioner Thomas, go ahead if you can.
Thank you, Erica. Yes, there are a lot of questions about testing, and the state has increased the number of tests per day that they would like Douglas County residents to participate in. So there are 5 locations in Douglas County where you can go get those tests. To find those locations, go to the county's website. That's douglas.co.us. And when you get to that homepage, there will be a block that says COVID-19. So click on that block for COVID-19, and that will take you to a page that has more information than you probably want on COVID, but that's where you'll find out where the testing sites are and if you can go those, if you're symptomatic, if you're not symptomatic. But please go to that website. There's so much information there for you. Thank you, Erica.
All right, thanks, Commissioner. And now let's go to a live question. We have Mary, and she is in Highlands Ranch. This question is for Dr. Douglas. Mary, you're live. Go ahead.
Thank you for taking my question. I would like to know if you can share any statistical data with regards to age range, sex, and pre-existing conditions of those who have been or currently are being hospitalized with COVID-19 in Douglas County.
This is for sorry, Mary. This is for hospitalization in particular. Is that right?
Yes, exactly.
No, I don't have that at the tip of my fingers. I will tell you that. I mean, what I can tell you is that the death rate, which is the most severe outcome, does appear to be occurring about 80% in those with either pre-existing conditions or over the age of 65. But I can't tell you hospitalization. It's a good question, and like the previous caller who asked me a good question and I couldn't answer, if you'll send me an email, we will try to get that information. And in fact, I'll try to figure out a way of sharing it more broadly because I think it may be of broader interest. I would guess the hospitalization data are going to look familiar, but much better for me to check it rather than guess. That email again is jmdouglas@tchd.org. Sorry, I don't have that available today.
All right, thank you, Dr. Douglas. And let's go to Commissioner Partridge. He has a recycling event that he would like to talk to that is coming up this week. Now, before we hear from Commissioner Partridge, again, just to backtrack a little bit, we would like to give the direct link to the testing page. That's, again, if you would like to get testing done or you need more information, just go to douglas.co.us/COVID-19-testing. All right, Commissioner Partridge, let's hear about this recycling event coming up.
Great, thank you, Erica. So here's our chance to provide a public service announcement. Last year was the first time the commissioners really took part in this, and we were amazed at the overwhelming response for recycling electronics. And we want you to know that coming up this Wednesday will be the first of 3 electronic recycling events. The first one here will be at the Douglas County Fairgrounds, and that'll be this Wednesday, June 17th from 9 p.m. to 3 p.m. There'll be another event again at the Douglas County Fairgrounds on, let me get that date right, that will be on July 15th. And then there'll be another one. This will be co-sponsored with the Douglas County School District on August 8th. So you have 3 chances, June 17th, July 15th, and August 8th. And so many electronics are allowed, and it is completely free. There's no cost. And if you would like to find out what items are going to be accepted, it's kind of a long email, but it's on our Douglas County website. And that is douglas.co.us/ and I'm just going to say community recycling event. You could probably seek that out through our website again, or certainly call and we can direct you to, and that number would be 303-660-7400. And even your old large TVs, or if any of you have any of those transistor radios that you were looking to get rid of if they're no longer in working order. So please visit our website and help us out. We really look at this event for a public service to help get rid of those electronic devices so they aren't just dumped in the trash, because there's certainly materials and chemicals involved in electronics that we don't want going into our regular rubbish system. So thank you all. Thank you, Erica.
Thank you, Commissioner. Next, we have an online question, and this is for Dr. Douglas. It's Faye, and she would like to know, if you are over 65 years old, how safe is it to drive for Lyft, Uber, or anything like that? Go ahead, Doctor.
Yeah, so that's a really good question. Lyft and Uber, I know, are both taking lots of precautions vis-a-vis disinfection of their vehicles after riders, with drivers wearing face coverings. Now, having said that, that's company policy. And if you were to hail a Lyft or an Uber and the driver was not wearing a face covering, I wouldn't get in because that might suspect other things aren't being carried out appropriately. I would say that if you've got other options for travel, those, especially from someone you know, that could be potentially safer. But I'd say Lyft and an Uber, where you're the sole passenger, especially if you have the capacity to control your own ventilation, roll down the windows, because breezes are terrific at dispersing virus. That's certainly a better option, for example, than public transportation, or really potentially even carpooling with 3 friends to get to an event. So we live in an era where you can't be completely sure about everything, but I do know the Lyft and Uber are both large corporations. They've instituted policies, and as long as the driver appears to be masked and you can control the windows, certainly during the summer, I think you ought to be able to travel with peace of mind in those sort of vehicles.
Wonderful. Thank you, Doctor. Next, we have another question for you. This is from Carol, and she says, the zoos have opened, and I would love to go with my grandkids, but I'm just not sure that it's wise because I also have Parkinson's. Go ahead, Doctor.
So, important question, and you've raised, like so many of the other callers, the issue of risk benefit and how does one statistically kind of work things out. I would say that if you are following the precautions we talked about over and over again with hand washing, hand sanitizer, face coverings, and if you were social distancing and you were going on a day with nice weather where you might not have to worry about a rain shower that would require you to try to get inside a facility where it might be more crowded while the thunderstorm went through, this sort of thing, I think your risk is likely to be generally low. Frankly, part of the risk could be being around your own grandchildren, and it would depend, of course, on what sort of situation they had been in. Had they been around a bunch of other kids where they themselves could have infection, and you almost, even in a zoo-like setting, because you're going to get there maybe by vehicle together, have some potential for interacting with them. So to me right now, rates of infection are low across Colorado. And it's a good time to be outdoors. And as already been said about 5 times on this call, loneliness is as important a health issue for all of us to be concerned about as COVID. And I don't want to minimize that. So if you've got the opportunity to do that and you can take those precautions, I think you can proceed realizing there is no such thing as risk-free. You could even be struck by lightning at the zoo. But I think you could proceed with some degree of comfort that you can do so safely with your grandkids.
Great, thank you. And Ms. Erickson and Ms. Fisher, could you both share your contact information again with our callers and a quick reminder of when they should contact you?
Okay, this is Carrie Erickson with Aging Resources of Douglas County. You can contact us for any questions or needed services around older adults in the county. We have resources and services available. 303-814-4300. Again, we are the only aging resource center that is a nonprofit in Douglas County. So you can call or contact us with all sorts of questions surrounding older issues.
And this is Gabrielle Fisher from Douglas County Human Services with the Eligibility Department. You can contact us at 303-688-4825. Again, that's 303-688-4825. You would contact us when you have a need for ongoing food assistance, so the Supplemental Nutrition Assistance Program, cash assistance, financial assistance, Medicaid assistance, or a variety of different medical programs that can help with insurance premiums and other items, or getting connected to other resources or community partners.
Great, thank you. Our next online question is from Jim. This is for Dr. Douglas. He says, my 96-year-old mother wants to go to the casinos. What's your recommendation? I am not comfortable with it. She lives with us, a family of 4, including 2 young boys and 3 adult children. My wife and I, who are 68 and 67. Doctor, go ahead.
Jim, that's an interesting question. The casinos are opening soon. I assume you'd be going, you in your 60s would be taking your mom in her 90s up to the casinos, so that involves at least 2, and if your wife goes, 3 folks that are at somewhat greater risk. Honestly, I think if it was me, I'd give this some time. The casinos are eager to, like Lyft and Uber and all kinds of other places, to get going safely. I'm sure they're taking the proper precautions, but with each decade of age, our risk of infection goes up. I couldn't answer the question a few minutes ago about hospitalization and age, but I can tell you for slam dunk sure that people in their 90s are at substantially greater risk than those in their 80s, who are in turn at substantially greater risk in their 70s, and on down the chain. So your mom is in a really, if you will, kind of highest risk setting, and it's fantastic that she's feeling well and active enough to want to go there. But I think I'd give that some more time. Partly, honestly, because it's an indoor setting. If you said she'd like to, be at the zoo with you and your family, as one of the earlier questions, given that that's an outdoor setting, I think I'd feel a little more comfortable. But I think until we sort of see how that whole proposition goes, given that we've got a couple of older folks that might be exposed, I think I would hold off on that.
Great, thank you. Let's now go to Elizabeth in Castle Rock, who also has a question for you, Dr. Douglas. Elizabeth, go ahead.
Hi, my name's Elizabeth. I'm from Castle Rock. I'm in my late 50s. I'm a home health nurse, married to an ER nurse at a Douglas County emergency room. And we also take care of a 56-year-old stroke survivor who's disabled. And I was put in the unique position of having to keep my ER husband healthy, but not letting him contaminate my homebound patient. So we navigated through that. But it made me wonder, what plan or plans are there being formulated or put in place in case this thing comes back in the fall, like some people are saying? Does Douglas County, and specific Castle Rock, have a mitigation plan for what we're going to do for people that are in assisted cares or nursing homes that do become ill, so that we're not in a New York situation where we're getting nursing homes running rampant with COVID? I mean, is there a plan for, and then secondly, my home health we got no protective care, no protective protection equipment. Medicaid, Medicare doesn't pay for it. So I had to take it on myself to go and buy stuff to make sure that the aides that were coming to help me take care of my brother, we were keeping him safe, and none of us got sick. My husband in the ER and the aides and myself taking care of my brother-in-law, none of us got sick. So we were able to keep cross-contamination from even happening. So it is doable. But what is the plan for the people who won't be in a home care setting?
Well, Elizabeth, you've asked a bunch of really important questions at the end of the day. Let me start with the plan for what if things get bad again sort of situation. The answer is yes, there absolutely are plans. Each long-term care facility, after having gotten burned so badly, as you point out, I mean, not every place, but clearly we had our greatest morbidity and mortality in folks living in long-term care facilities. That situation has gotten markedly better. I would not pretend it's perfect, simply because you've still got a lot of vulnerable people living together, and lapses in infection control or even lapses in personal protective equipment could potentially result in more outbreaks occurring. I will say that as the health department covering Douglas County, we've tried to, think a couple of steps ahead down the chessboard. We've got a long-term care facility outbreak response team, as well as a community-based outbreak response team, with the idea that we can jump on outbreaks more rapidly than we were able to do previously. We are also working with the state to try to extend a program that they've started of testing all long-term care facility workers on a once-a-week basis, since, especially in the absence of very many visitors, it was the workers themselves who were introducing infection into the facilities. Thirdly, every variance that Commissioner Thomas and Partridge have referred to contains a suppression plan that goes along with it. Now, I want to be really clear that if we begin to have more problems, higher rates of infection, hospitals being oversurged, it's going to take will across the community, from the health department, from our elected officials, from our healthcare providers like you and your husband, and frankly, the community at large, to realize that some very unpleasant things, potentially having to restrict certain businesses that have opened or particular schools that have opened, stuff that we are desperately hoping doesn't have to happen, could happen again. And a big part of why we do monitoring and why we're going to be doing contact tracing is to try to avoid that. But I just need to, you've asked me an honest question. You and your husband are on the front lines, and I want to give you an honest answer that we're going to have to be prepared as part of our toolkit of response if things get really bad, to think about that sort of stuff again. None of us want it to happen. I hope that we're going to avoid it. I'm very distressed, and I hadn't heard, to move to your second question, that home health providers are having difficulty getting personal protective equipment. This is not a question that I've encountered before, and I'm sort of doing the same thing with you. I've done with several other questions. I'd love for you to send me an email about this and describe your understanding of the situation so we can explore it a little bit. Honestly, I don't know. It sounds like you've looked into it pretty hard and haven't found a solution, but I'd like my team to do so, because you're a vital provider, and I'm not quite sure what's going on that you're not able to get PPE. So thank you for those really excellent questions.
Thank you, Dr.
By the way, my email, Elizabeth, just to say it again, JM, got to put the M in there, it won't get to me, Douglas@tchd.org. Sorry, Erica.
No worries. Thank you. All right. Thanks to everyone who joined us this morning. You've asked so many thoughtful questions, and we really appreciate everyone taking the time out of your morning to be with us. We're grateful to you, Dr. Douglas, Carrie Erickson, and Gabrielle Fisher, and the Board of County Commissioners for their input today. So a final reminder, if your question was not answered this morning, we encourage you to visit douglas.co.us/citizenconnect, and you could submit your question and we will respond. You can also call the Aging Resources of Douglas County call center. That's 303-814-4300. And if you need to reach Human Resources, if it is a Human Resources question, you can call 303-688-4825. Be sure to join us again this Wednesday, June 17th, for our weekly update, Your Health and Safely Reopening Our Economy. Now, before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for final comments. Commissioner Laura Thomas, why don't you go first?
Thank you, Erica. I'd like to thank, we have almost 3,000 people on the call right now. And so what that's able to do is give you information directly. So you're not trying to be on phone lines or emails or websites trying to figure out what the truth is, because this really is complicated for us. And I've been sitting here at my desk every day for 3 months trying to figure all this out. So thank you for spending the time to hear what's going on. I spent yesterday, we were in the car just driving around Douglas County. It's a beautiful county. And we looked at the scenery we took out on different roads. And I had the opportunity to go to a baseball tournament yesterday at Double Angel Park in Parker. And it was so fun to see all those kids out on the ball fields playing. And, there's light at the end of the tunnel. So go out there and enjoy those vast, great outdoors. Thank you, Erica.
Thank you. And now to Roger Partridge, our other Douglas County Commissioner. Go ahead.
Thank you, Erica. Thank you, Commissioner Thomas, and thank you to the listening audience, and certainly our esteemed guest of Gabrielle, Carey, and Dr. Douglas. We thank you so much for helping us out. So as we look at this, please know your Douglas County Commissioners and especially our staff have worked very hard to continue to help you understand and get through this and for greater opening for the right reasons. And Commissioner Thomas mentioned this before, we are the healthiest county in the nation. And that is a real tribute to you. So when we think about how do we prepare if there is anything that's going to happen, so we certainly don't know, but let's prepare. So certainly eat healthy, consider taking supplements, drink plenty of water, get regular exercise, and certainly adequate sleep, and do everything you can to minimize the stress in your life and your family's life, because that stress we know can be an aggravating factor. So be happy, be well. We ask that you be blessed. Thank you again for the opportunity to address your concerns and issues. God bless.
Thank you, Commissioner. On behalf of Douglas County and the Tri-County Health Department, thank you for sharing your morning with us. We hope you'll join us again this Wednesday, June 17th at 4:30 for the Your Health and Safely Reopening Our Economy weekly update. Be well, be blessed, and have a great day.